Brain cancer. It starts with headaches, not the kind that come and go after a long day at the screen. These are different. They wake you up at 3 a.m. and sit behind your right eye like something is pressing outward from the inside. You take ibuprofen, you drink water, you blame the stress. Then one morning you reach for your coffee mug and your left hand doesn't close the way you told it to. You look at your fingers like they belong to someone else. They do it again in the afternoon. You tell yourself it's nothing. You Google it once and immediately close the tab. The scan takes 20 minutes. The conversation after takes 3. The doctor points to a white mass on a gray image and says words like grade and location and options. The mass is sitting in your motor cortex, which is the part of the brain that translates your thoughts into movement. This is not good news. Even small tumors in the wrong place can rewrite what your body is able to do. Yours is near enough to the surface that surgery is possible, but the margin for error is measured in millimeters. Your body is already changing in ways that feel like they belong to a stranger. You drop things, you lose words mid-sentence, reaching for a noun that isn't there anymore. One morning, you have a seizure in the kitchen. You don't remember it. Your partner describes it to you later in a voice they are working very hard to keep level. The tumor is not stealing your memories. It is stealing your body's ability to execute what your mind is asking it to do. You think something and the signal doesn't arrive. This is its own particular kind of horror. Surgery takes 7 hours. They keep you awake for part of it so they can ask you to name objects and move your fingers while they work, because the only way to know they haven't cut the wrong thing is if you keep telling them they haven't. Radiation follows, then chemotherapy. You are tired in a way that sleep doesn't fix. You write things down now because you can't trust them to stay. You make lists. You send the emails the same day you think of them. You sleep every night knowing that somewhere inside your skull, in an organ that cannot be fully mapped or fully protected, a decision is being made that you have almost no say in. You have given everything you have to the people who are fighting it for you. The rest is waiting. Breast cancer. You find it yourself. That is how most people find it. In the ordinary private moment of a shower or a restless night, when your hand passes over something that doesn't feel like it should be there. A lump, about the size of a marble, just inside the left breast near the outer edge. It doesn't hurt. That is the first thing that surprises you. You assumed pain would be the signal. It isn't. You wait 2 weeks before calling the doctor. You tell yourself you're being sensible, that it is probably nothing, that your body does strange things sometimes. What you are actually doing is protecting yourself from the moment when it becomes real. The mammogram is cold and mechanical and over in 10 minutes. The biopsy hurts more than they said it would. The wait after that is 5 days, which is the longest 5 days of your life so far. The diagnosis is invasive ductal carcinoma, stage 2. The doctor uses the word treatable, and you hold onto it like a rope. You are one of roughly 300,000 women diagnosed in the United States this year. That number means nothing to you. What means something is that you have to call your mother. You have to tell your kids. You have to figure out how to say a word that still feels like it belongs to other people. Your body is being colonized in a way you cannot feel directly. The cancer is not painful yet. What is painful is the treatment. Chemotherapy starts 6 weeks after diagnosis. The first infusion takes 4 hours. By day 3, you understand what they meant by fatigue. This is not tiredness. This is a heaviness that starts in your bones and works outward. Your hair begins to come out in the second week. First in the brush, then in the pillow, then in your hands in the shower. You shave it before it can keep falling. You look at yourself in the mirror for a long time. Then you put on your earrings and you go to work. Surgery follows chemotherapy. A lumpectomy removes the tumor and the margin of surrounding tissue. Radiation comes after that, 5 days a week for 6 weeks. You drive yourself to the hospital every morning and lie under a machine for 8 minutes and drive home. You stop explaining to people why you are always tired. Some days you feel almost normal. Some days normal feels like a place you visited once and can't quite get back to. You sleep in a body that has been through a war it did not start. The scans are clear. You are in remission. You keep the appointments. You do the checks. You live, carefully and loudly, and with an attention to things that used to pass by unnoticed. You sleep knowing you did not let it have you without a fight. Lung cancer. The cough has been there for months. You have explained it to yourself a dozen different ways. Dry air, allergies, that cold that never fully cleared. You are not a smoker, or you were one years ago and you stopped, or you are one now and you have already done the math and pushed the answer somewhere you don't look. The cough is dry and persistent and sits in your chest like something that does not want to leave. Then there is blood. Not a lot, a small bright red streak in the tissue when you pull it away from your mouth. You sit with that for a moment in the bathroom with the door locked, and then you make the call you have been putting off. The CT scan shows 2 masses in the right lower lobe. Your oncologist tells you it is non-small cell lung cancer, which is the more common of the 2 types, and that it has been found early enough that surgery is still an option. This is the best news you could receive inside what is still very bad news. Lung cancer kills more Americans than any other cancer. It is not because it is the most common, it is because by the time most people find it, the window is already narrowing. Your lungs, the 2 organs you have never once thought about in your entire adult life, are now the center of everything. Breathing, which was automatic, is now something you notice. The masses take up space. Your breath shortens when you walk upstairs. You feel a dull pressure in the right side of your chest that is always there now, like a hand pressing from the inside. Before surgery, you are told what the risks are in language that is careful and complete. You nod. You sign the form. You call the people you love that night and talk longer than usual without explaining why. The surgery removes the lower lobe. You wake up with a tube coming out of your chest and the pain that makes every breath a negotiation. You are in hospital for a week. Chemotherapy starts a month later. The side effects are nausea, fatigue, hair loss, a sensitivity to cold that makes touching a refrigerator door feel like gripping metal in winter. You keep going. You have to keep going. You sleep with the window cracked because you want to hear yourself breathe. You go back every 3 months for a scan. You sit in the waiting room and watch the number on the screen and wait for your name. Clear again. You exhale fully, the way you used to without thinking, and you feel something close to grateful for every ordinary breath you are taking. Prostate cancer. You notice it at night. You get up to use the bathroom at 2 in the morning, and again at 4, and again just before the alarm. This has been happening for weeks, maybe longer. You are 58. You assume it is age. You assume it is the coffee you drink too late in the afternoon. You keep meaning to mention it. Your doctor brings it up first at your annual check, asking the questions you have been quietly hoping no one would ask. The PSA blood test comes back elevated. An MRI shows a suspicious area. A biopsy confirms it. Prostate cancer. Gleason score 6, which puts it in the low to intermediate risk category. Your urologist uses the phrase active surveillance and explains that this is a real treatment plan, not a way of doing nothing. Many men live with low-grade prostate cancer for years without it changing their lives significantly. You are not sure if that is reassuring or not. The prostate is a small gland at the base of the bladder, and it has an outsized influence on your daily life once it starts causing problems. The urge to urinate comes suddenly and often. The stream starts and stops. Some mornings you stand there for a full minute before anything happens. You do not explain this to your colleagues when you disappear to the bathroom 3 times in an afternoon. You adjust. You find the bathrooms in every building you regularly visit. You stop ordering a second coffee. The decision about treatment is yours to make, but it does not feel that way to you. Surgery to remove the prostate is effective, but carries a real risk of incontinence and erectile dysfunction, both potentially permanent. Radiation carries similar risks. Active surveillance means living with uncertainty, watching the numbers, hoping the grade does not creep upward. You sit with these options at the kitchen table after everyone else has gone to bed, and you read until you stop understanding what you are reading. You choose surgery. The recovery takes longer than you expected. There are weeks where your body feels like it belongs to someone older than you. Things improve gradually, not all at once, not completely. You go back for the PSA test every 6 months. The number stays low. You sleep at 59 knowing things about your body you did not know at 58. You have become someone who does not take the small mechanics of living for granted. You get up in the night and you walk to the bathroom, and you are glad that everything is still more or less working. That is enough. Leukemia. Childhood. You are 7 years old and you are tired in a way that no 7-year-old should be tired. Not sleepy. Heavy. Your legs ache when you walk to the car. Your mom thinks you are coming down with something. She gives you children's paracetamol and an extra blanket and waits for the fever to break. The fever doesn't break. At the hospital, they take a lot of blood, more than seems reasonable for someone your size. The doctors speak quietly to your parents in a way that tells you something serious is being decided nearby, but not with you. You are given a bed with a television. Later, your mom holds your hand for a long time without saying anything, and you know then that this is bigger than a fever. Acute lymphoblastic leukemia, the most common childhood cancer. Something went wrong in the bone marrow, the part of you that makes blood, and instead of making normal white blood cells, it started making broken ones, fast and in enormous numbers. Cells that crowd out the healthy ones until your blood can barely do its job. Your immune system is failing. Your body cannot fight normal infections. You bruise from almost nothing. Your bones hurt, not on the surface, but deep, the kind of pain that cannot be rubbed or stretched away. A nurse asks you to rate the pain from 1 to 10. You say 7 because you are trying to be accurate. Chemotherapy starts almost immediately. It runs in cycles over 2 to 3 years. The drugs go into a port they put in your chest so that your arms don't have to take every needle. You lose your hair by the 3rd week. This upsets you less than the nausea, and less than the way food tastes like nothing or like metal depending on the day. You miss school. Friends visit less and less, partly because they don't know what to say, and partly because you are too tired to talk for very long. You watch a lot of television. You become an expert in animals and geography, and the kinds of facts that stick in your mind because there is nothing else requiring your attention. The hospital is its own kind of world. You know the nurses by name, you know the smell of the ward, and the sound of the monitors, and the exact temperature of the blankets they bring from the warmer at night. Your parents take shifts. One of them is always there. There are bad weeks and better weeks. The bad weeks are very bad. The better weeks feel like being let outside after a long winter. You are 10 when the scans come back clean. The doctor shows you the numbers and says remission, and your mom cries in a way that is different from all the other crying. You go back to school. You are small and pale, and you get tired before the others do, and none of that matters. You sleep in your own bed in your own room with the door open the way you have always liked it. You are 10 years old, and you have already survived something most adults never will. Skin cancer. Melanoma. It looks like a mole. You have always had moles, and you have never thought much about them. This one is on your left shoulder blade, somewhere you can only see it by contorting yourself in front of a mirror, and you would never have noticed it at all except that your partner mentions it in passing one afternoon. It looks a little uneven to them, one side darker than the other. You take a photo of it on your phone, you compare it to pictures online for 20 minutes, and then you decide to have it looked at, mostly to stop thinking about it. The dermatologist uses a dermatoscope and goes quiet in the way that tells you something before the words do. The biopsy takes a week. Melanoma. Stage 1, which means it has not yet spread beyond the surface of the skin, which means the news is as good as it can be inside the word melanoma. Melanoma is not the most common skin cancer, but it is the one that kills. It accounts for about 1% of skin cancers and the majority of skin cancer deaths because of how quickly it spreads once it reaches the lymphatic system or the bloodstream. You found it early. Your partner found it. You have been thinking about that fact ever since. What melanoma does to your body in the early stages is almost nothing. There is no pain. There is no fatigue. There's a small irregular mark on your shoulder that looks unremarkable to anyone who knows what they are looking at. This is exactly what makes it dangerous. Skin cancer doesn't announce itself. It waits. It grows slowly, and then suddenly it doesn't grow slowly at all. Surgery removes a melanoma and a wide margin of surrounding skin. The excision is done under local anesthetic and leaves a scar about the size of a thumb. You watch the ceiling for 40 minutes and listen to the surgeon work and feel pressure without pain. The wound heals in 2 weeks. You go back every 3 months to have your skin checked, every centimeter of it, by a person with a lamp and a loop who takes their time. You have started doing the checks yourself between appointments. You stand in the bathroom and work through your body section by section. You look at every mole. You photograph anything that changes. You wear sunscreen every day now, regardless of the forecast. Not because you are afraid, though you are a little afraid, but because the intervention costs you 30 seconds in the morning and the alternative was made very clear to you at stage 1. You know people who didn't find theirs at stage 1. You think about them when you open the cabinet. You sleep with a small scar on your shoulder that you will carry for the rest of a life that is, because of one observation and one appointment, very likely going to be long. Pancreatic cancer. The first symptom that brings you to a doctor is not pain. It is the color of your eyes. You notice it in a photo taken at a family lunch, a slight yellowish tinge in the whites that wasn't there before. Jaundice. Your GP sends you for an ultrasound the same week. The ultrasound finds a mass in the head of the pancreas, about 3 centimeters across. The pancreas sits deep in the abdomen, tucked behind the stomach, and by the time a tumor in it is large enough to cause symptoms, it has almost always been growing in silence for a long time. The staging scans take 4 days. In those 4 days, you eat and sleep and talk to your family and try to keep things ordinary while a separate part of your mind runs continuously in the background, processing a possibility you are not ready to speak out loud. The results show that the tumor has not yet invaded the major blood vessels nearby and has not spread to distant organs. You are told you are among the approximately 20% of pancreatic cancer patients eligible for surgery. You understand immediately that the other 80% are not. The pancreas is a quiet organ that you have never once had a cause to think about. You now know that it makes the enzymes that break down your food and the hormones that regulate your blood sugar, and when a tumor grows inside it, it starts doing something no organ should ever do. It begins to digest itself. The enzymes that were meant to break down your food start working on the tissue around them. The pain this produces is extraordinary. It lives in your upper abdomen and radiates into your back, and it does not respond well to standard painkillers. You learn the word breakthrough pain, which describes the moments when the pain exceeds what the medication can contain. You have more breakthrough moments than you expected. The surgery is called a Whipple procedure, and it takes 6 to 8 hours and removes the head of the pancreas, part of the small intestine, the gallbladder, and the lower part of the bile duct. You are in hospital for 2 weeks. The recovery is longer than anything you have previously recovered from. You lose weight that you struggle to get back. You develop diabetes because the insulin-producing tissue is gone. Chemotherapy starts 6 weeks after discharge. You make it to appointments because you make the appointments, and then you make yourself go. You sleep with a body that has been fundamentally reorganized by something you almost missed. The pain has changed, quieter now, but always present in some form. You have a list of medications you take in a specific order at specific times, and you do not miss a dose. You are 3 months out from surgery. The scan is next week. You are still here. That is the only metric that matters right now, and by that metric, you are winning. Thyroid cancer. You find it during a routine physical. Your doctor runs their fingers along the base of your neck and pauses. There's a small nodule on the left lobe of your thyroid that wasn't documented last year. They are careful about their tone when they tell you this. Thyroid nodules are extremely common. Most of them are nothing. This one needs to be looked at more closely. An ultrasound is followed by a fine needle biopsy. The cells come back as papillary thyroid carcinoma, which is the most common type and the one with the best prognosis. You are 34. You are otherwise healthy. Your oncologist is calm and specific and uses the word excellent more than once. The 5-year survival rate for thyroid cancer caught at this stage is close to 98%. You hold that number carefully. You also know that hearing the word cancer in a sentence about your own body changes the quality of everything that follows it, no matter what percentage they attach to it. The thyroid sits at the front of your neck like a small butterfly, and until it has a tumor growing in it, you have thought about it exactly never. It controls your metabolism, your heart rate, your body temperature, your mood. The cancer itself does not cause symptoms that you have noticed, but as you read back through the last several months, you wonder about the fatigue you attributed to work, the slight difficulty swallowing that you assumed was anxiety. The cancer had access to the lymphatic system of your neck, which is one of the most connected highways in the body. It has not used it yet. The goal of treatment is to make sure it never does. Surgery removes the entire thyroid. You are under general anesthetic for 3 hours. You wake up with a neat horizontal scar just below your collarbone and a temporary drain coming from the incision. Your voice is slightly hoarse for 2 weeks because the nerves to your larynx run directly behind the thyroid, and the surgeon has had to work within millimeters of them. Radioactive iodine therapy follows 6 weeks later. You swallow a capsule and you are mildly radioactive for a week, which means you sleep in a separate room and use separate dishes and stay away from children and pregnant people. This is a strange and solitary week. After that, you take a small thyroid hormone pill every morning for the rest of your life. Without your thyroid, your body cannot produce the hormones it needs to function. The pill replaces them. You get a blood test every 6 months to make sure the levels are right. If they drift too high or too low, you feel it immediately in your energy, your weight, your sleep, your mood. You become an expert in your own chemistry. You sleep with a thin scar on your neck and a pill on your bedside table, and a prognosis so good that your oncologist sees you once a year now instead of every 3 months. You feel the scar sometimes when you look in the mirror, and you feel something that is not quite pride, but is in that direction. You caught it. You dealt with it. You are still entirely yourself.